Dear students, I am Dr. Hardeep Kaur from Department of Zoology, Ramjas College, University of Delhi. Today I am going to talk about immunity in health and disease from paper Immunology of subject Zoology. Now, if we need to define autoimmunity, we can define it by saying that it is a state in which a structural or physiological harm is produced by the action of specialized cells of our immune system. It is generally in the form of antibodies against normal components of the body. It occurs when the immune system recognizes and attacks host tissues. Multiple cell types of a single lineage that compose the immune system together form the important component of innate and acquired immunity. The two systems interact and form a protective envelope of an individual. Autoimmune diseases are due to the aggravated interaction between the two systems. Disruption of immunological tolerance towards self-antigens leads to origin of an autoimmune disease. Now, what are the key factors that lead to autoimmunity? It's very difficult to describe them. Several factors are thought to be responsible for the development of immune response to self-antigen. For example, these diseases are found to have a strong link to human leukocyte antigen, that is HLA genes. The environmental factors also play a key role. For example, in multiple sclerosis, there is a greater concordance in monozygotic than dizygotic twins, indicating that genetic factors are important. Even so, the concordance in monozygotic twins is not complete, suggesting a role for environmental factors and not genetic factors alone. At present, group of 60 to 80 chronic inflammatory diseases are known. Today, we'll be learning few of the important things of autoimmunity. What are autoimmune diseases? Mechanism or causes of such diseases, type of disorders, pathogenesis of the disease, methods of diagnosis and treatment of autoimmune diseases. Although the role of autoimmunity in various disorders is not clear, it is generally believed that all diseases generally associated with these features can be called autoimmune diseases. These features are high level of immunoglobulins, mostly autoantibodies, accumulation of antibodies, lymphocytes and plasma cells at a specific site of lesion, genetic predisposition to autoimmunity, more common in females. Immunosuppressive therapy is effective. It follows a chronological order and they are generally non-reversible. These features, one very important feature that needs special mention is the bias shown by autoimmune disorders towards women. As per a study conducted at National Institute of Health NIH, women were found to be 3 times more susceptible than men to develop autoimmune disease. Common autoimmune diseases that are predominantly found in females are systemic lupus erythematosus, postpartum thyroiditis, Hashimoto's or Graves' thyroiditis, rheumatoid arthritis, type 1 diabetes mellitus, antiphospholipid syndrome. It has also been found that women tend to display higher levels of certain antigens that are potential trigger of the autoimmune responses. Most of these disorders are also linked to the endocrine fluctuations or hormonal imbalance in females. To go back in time and understand the history of immunology, the first known reference to such a phenomena in nature was by the immunologist Paul Ehrlich, wherein he spoke about horror autotoxicus in reference to horrors of self-toxicity. Paul Ehrlich was a German scientist who worked in the field of immunology and hematology. Besides his tremendous contribution in immunology, he will forever be remembered for his invention of Gram staining technique, a technique we all are very well aware. He also pioneered the use of arsenophenamine for treating syphilis. Ehrlich received the Nobel Prize in 1908 in physiology or medicine for his innumerable contributions to immunology. The friendship between Ehrlich and Robert Koch, another very renowned name in the field of immunology, is legendary. So it was Ehrlich who first highlighted the phenomena of autoimmunity. Later in 1900, Sergei Metlinikov, he is different from the Metchnikoff we all very well know. Sergei Metlinikov found out that the injection of his own sperms or spermatozoa in guinea pigs produced certain antibodies that immobilized the sperms. Doneth and Landsteiner in 1904 identified circulating autoantibodies in paroxysmal cold hemoglobinuria. The autoimmune basis of acute hemolytic anemia was first established by Demchik and Schwartz in 1938. Later, the use of sensitive serological techniques led to the demonstration of autoantibodies in several diseases and even in proportion of healthy individuals. It is now clear that the mechanism of self-tolerance normally protects an individual from self-reactive lymphocytes. There are failures that result in an inappropriate response of the immune system against self-components. Many a times, the damage to the self cell is caused by antibodies. However, we must not forget that T cells are equally responsible in autoimmunity. Now, let us understand the mechanism or causes of such diseases. There are many known and sometimes not very well known reasons for autoimmunity. The first such cause is neoantigen. The cells or tissues of the body may undergo certain changes or alterations that could be physical, chemical, or of biological nature to turn them into potential neoantigens against which an immune response could be mounted. For example, contact dermatitis, which is a delayed type hypersensitivity, that is type 4 reaction, is an example of normal body cells coming in contact with certain chemical allergens. Some other causes include the similarity between some foreign and self-antigen. This could lead to cross-reactivity. For example, streptococcal group A proteins and muscles of heart have striking similarities and can therefore lead to rheumatoid heart diseases. Molecular mimicry. Here the similarity between the foreign antigen and the self-antigen is restricted to certain epitopes only, hence befooling the immune system. For example, similarity in certain epitopes between Mycobacterium tuberculosis and joint membranes. Hidden antigens. Hidden or sequestrated antigens may not be antigenic. However, on being released due to any reason, they may become potential antigens. For example, lens of eye, that is the lens protein, is generally found enclosed in the capsule and hence not freely circulating. Therefore, tolerance to this protein is not achieved by the immune system of the individual. On exposure to this protein, the immune system will therefore mount an immune response. This is generally the case where trauma to one eye can destroy the non-traumatized eye as well. Polyclonal B cell activation. Generally, a particular antigen will only stimulate its corresponding B cell. However, many virus and bacteria can act as superantigens, or certain chemical stimuli can turn on many B cell clones. The nature of these antibodies is generally IgM, similar to the ones that are naturally produced. For example, lipopolysaccharides produced by gram-negative bacteria is an androtoxin that can cause polyclonal cell activation. Mutation. Immunocompetent cells may suddenly turn hostile due to some mutation and may start producing immune response against self-antigens. Breakdown of immunological homeostasis. Tolerance to self-antigens is inbuilt during maturation and differentiation of immune cells. However, the breakdown of this homeostasis due to any reason can cause total collapse of tolerance to self-antigens. Mutation may be one of those reasons. Defective immunoglobulin gene or potential B or T cells can also cause autoimmunity. Of course, certain genetic factors can also make a person more prone to autoimmune disorders. Autoimmune diseases may be classified according to the place or the site at which they are affecting or the organs they are affecting. For example, the classification of autoimmune diseases can be as a hemocytolytic disease, localized or organ-specific diseases, systemic or non-organ specific diseases, or transitory diseases. Let us first understand the hemocytolytic autoimmune disease. The autoantibodies in this disease are directed towards the blood cells. Autoimmune hemolytic anemia or AHA. This occurs when antibodies are directed against the person's own red blood cells or RBCs. This can cause complement-mediated lysis or antibody-mediated opsonization followed by phagocytosis of RBCs. The RBCs hence get burst. This leads to insufficient plasma concentration. The lifetime of the RBCs is hence reduced from 100 to 120 days to just few days. The components of the RBCs are hence released in the tissues and it leads to characteristic symptoms of the disease. This condition in humans are very rare, with only 1 to 3 people per 100,000 per year suffering from AHA. Autoimmune leukopenia. The term autoimmune leukopenia or autoimmune granulocytopenia and autoimmune neutropenia are used synonymously to describe the condition. In this condition, autoantibodies are directed against leukocytes, as in case of systemic lupus erythematosus, which is typically more common in women between 20 to 40 years of age. Although a person suffering with lupus has autoantibodies against vast variety of tissue antigens, however, non-agglutinating anti-leukocytic antibodies are fairly common. This further leads to reduction in total white blood cell volume to less than about 4,000 cells per deciliter of blood. Autoimmune thrombocytopenia. The autoantibodies are particularly directed against platelet membrane protein. Autoantibodies against blood platelets leading to idiopathic thrombocytopenic purpura is a typical example. This leads to low platelet count with normal bone marrow and absence of other causes of thrombocytopenia. It causes a characteristic purpuric rash and an increased tendency to bleed. Coming to next type, that is organ-specific or localized autoimmune disease. In this case, the immune response is targeted to organ-specific antigens and hence the symptoms of the disease is restricted to a particular organ only. Hashimoto disease or lymphadenoid goiter. Autoantibodies are specific to thyroglobulins and thyroid peroxidase. Both these enzymes are responsible for iodine uptake. Binding of antibodies to these proteins leads to reduction in the production of thyroid hormone causing hypothyroidism. DTH, that is delayed type hypersensitivity reaction, leads to infiltration of organ with phagocytes and plasma cells and further enlargement of thyroid glands causing goiter, as you can see in the picture. Mostly seen in middle-aged women, autoantibodies and sensitized TDTH that are specific for thyroid antigens are produced. Myasthenia gravis. In this disease, autoantibodies are produced against acetylcholine receptors on motor end plates of muscles. This not only blocks normal binding of acetylcholine to its receptor but also leads to complement-mediated degeneration of receptors. The result is weakening of skeletal muscles. Addison's disease. The immune system functions against the adrenal glands. Adrenal glands are responsible for producing cortisol and aldosterone. Cortisol is very important for regulating the body's reaction to stressful situations. Aldosterone helps in regulating sodium and potassium levels in the body. In Addison's disease, the production of these hormones stops. Thyrotoxicosis, that is Graves' disease. Binding of thyroid stimulating hormone, that is TSH, which is produced by the pituitary gland to thyroid cell receptor leads to synthesis of two hormone, thyroxine and triiodothyronine, which we call T4 and T3. This mechanism, as you can see, also has a negative feedback control. However, autoantibodies to TSH receptor leads to their binding to the receptor protein and activating the cycle of hormone production, thus completely mimicking the role of thyroid stimulating hormone. However, unlike TSH, the activated cycle here is without any regulation, and this causes overstimulation of the thyroid gland. These autoantibodies are also therefore called LATs, that is long-acting thyroid stimulating antibodies. Autoimmune orchitis. This is the autoimmune disease of the testis with the presence of specific anti-sperm antibodies ASA. ASA induces apoptosis of spermatocytes and spermatids and can lead to immobilization or agglutination of spermatozoa. This hence can cause impairment of fertility. Autoimmune disease of skin. There are many different types of skin-related autoimmune disorders, including scleroderma, psoriasis, dermatomyositis, epidermolysis bullosa, and bullous pemphigoid. Rosacea is a skin disease that can cause redness of forehead, chin, and lower half of nose. This is caused by chronic inflammation of body tissues due to autoimmune disease disorder. Autoimmune disease of eye. The autoimmune disorder of eye can be further classified as phacoanaphylaxis, that is, autoimmune response to the protein of lens of the eye, which has been induced by escape of material from the lens capsule, or sympathetic ophthalmia. It is a bilateral diffuse granulomatous uveitis in which both eyes get affected. This generally occurs if one eye has undergone trauma of some kind. The affected individual can turn completely blind. It is an autoimmune inflammatory response towards ocular antigens that are released due to damage to the eye. Pernicious anemia. This order occurs due to destruction of parietal cells of the stomach. This in turn causes further inactivation of intrinsic factors by autoantibodies so produced. Absorption of vitamin B12 from the digestive tract is dependent on the presence of intrinsic factor. Therefore, lack of the factor would lead to vitamin B12 deficiency. Autoimmune disease affecting this nervous system. Multiple sclerosis, more popularly known as MS, is an autoimmune disorder of central nervous system that primarily involves destruction of myelin sheath. The function of myelin sheath, as we all know, is to coat nerves and help in nerve impulse transmission. The process of myelin sheath destruction is hence called demyelination. This further results in damaged nerves that are incapable of transmitting impulses. In Guillain-Barré syndrome, myelin sheaths of peripheral nervous system are destroyed. Now next are non-organ specific or systemic autoimmune disease. In systemic autoimmune diseases, the immune response is directed towards a large range of self-antigens and damage of a number of organs and tissues takes place. Rheumatoid arthritis. It is a systemic chronic disorder mainly affecting synovial tissues. Rheumatoid factor or the RF factor is the autoantibody first found in this disease. Swelling and tenderness in the joints is the characteristic feature of this disease. It is further associated with joints becoming so stiff that movements can get totally hampered. When multiple joints get affected, the condition is called polyarthritis. The disease generally affects small joints of the hands, feet, and cervical spine, but larger joints like shoulder and knee can also get affected. Systemic lupus erythematosus or SLE, or most commonly called lupus. It affects many internal organs in the body. In SLE, the autoantibodies are most commonly formed against a variety of tissue antigens. The organs and organ systems that get affected include lungs, heart, liver, kidney, joints, skin, blood vessels, nervous system, etc. The progression of the disease is generally combined with periods of acute illness, which is called flares, followed by a period of latency or remissions. The disease is found more in women of ages 20 to 40 when they are reproductively most active. The presence of butterfly rash on the face, as you can see in the picture, is a diagnostic feature. The autoantibodies can be against the DNA, histones, RBCs, platelets, leukocytes, or clotting factors. Polyerythrocyte nodosa or polyarthritis nodosa or PAN. It is a systemic vasculitis and is differentiated by inflammatory lesions in the arteries resulting in microaneurysm formation, aneurysmal rupture. This leads to hemorrhage, thrombosis, and eventually organ ischemia or infarction. It is generally fatal due to coronary thrombosis, cerebral hemorrhage, or bleeding in gastrointestinal tract. Sjogren disease syndrome. Dry eyes and dry mouth are the most common symptoms of this Sjogren syndrome. This syndrome generally accompanies rheumatoid arthritis and SLE. The autoantibodies generally affect the mucous membranes and moisture-secreting glands of eyes and mouth. Dermatomyositis, it is a connective tissue disease accompanied with inflammation of the muscles, that is inflammatory myopathy, and the skin. A distinctive skin rash and muscle weakness is the main symptom. Lungs, esophagus, hearts, and joints also get affected by the disease. Scleroderma, also called systemic sclerosis, is a connective tissue disease. The word scleroderma originates from two Greek words, sclero meaning heart and derma meaning skin, with hardening of skin being its most distinctive feature. The disease is generally grouped as one of the autoimmune rheumatic disease. The exact causes are unknown, but there is increased production of collagen in this disease. It mostly affects female in comparison to males. Transitory diseases. These are those diseases that follow or trail certain infections or drug therapy. Most of these diseases are short-lived and recede once the primary infection is controlled. They are anemia, that is decrease in the number of red blood cells or RBCs or hemoglobin in the blood; thrombocytopenia, that is decrease in the levels of thrombocytes or platelets in the blood; nephritis, that is inflammation of the kidney along with glomeruli, tubules or interstitial tissue surrounding the glomeruli and tubules. So dear students, by now you must have understood what are autoimmune diseases. You can easily define autoimmunity now. You can understand the mechanism or causes of such diseases, the known and not so known reasons behind autoimmune disorders, the type of disorder or rather the classification of autoimmune disorders. Just to remind you again, autoimmune disorders can be hemocytolytic or directed against the blood cells. They can be organ specific or localized, non-organ specific or systemic, or can be transitory in nature. Now let us further understand the pathogenesis of the disease. What is happening inside the body? The method of diagnosis, very important. How to diagnose these diseases, and further, having diagnosed the proper disorder, let's treat these autoimmune diseases and all the processes that are involved in treatment of autoimmune diseases. Now let us understand the pathogenesis of the disease. The key components of the immune system are the cell-mediated immunity and the humoral immunity that effectively protects our body from invaders. Humoral immunity is found to play a major role in autoimmunity. However, we cannot undermine the role played by the T cells also. Many tolerance checkpoints exist to prevent the insistent growth of self-reactive B and T lymphocytes. These self-reactive clones hence evade series of tolerance checkpoints, and this results in development of autoimmune diseases. As you can see from this slide, the breakdown of a cell due to any reason, the cell death lead to release of certain cellular components which can become an antigen and hence can stimulate These autoantigens can stimulate T lymphocytes and B lymphocytes. This is the basic crux of autoimmune diseases. Many of these checkpoints, which are very important to make sure that autoimmune diseases do not take place. However, these checkpoints bear very much similarities to the ones which are involved with tumor suppression. As in some cases of tumor, an individual's inherited predisposition plays an important role in the development of cancer. In a similar manner, inherited genes could also play a tremendous role in development of autoimmune diseases. Hence, we say that genetic factors are equally responsible, although whether totally responsible, it is yet to be ascertained. How to diagnose these diseases? With nearly 80 different types of autoimmune diseases, the accurate diagnosis becomes all the more important. A thorough review of the history, symptoms, physical examination, combined with certain blood tests can help in effective diagnosis. For certain autoimmune disorders, detection of serum autoantibodies provide a valuable tool. Many diagnostic kits make use of this technique. Since some autoimmune disorders can cause abnormal functioning of certain organs, therefore, routine immune fluorescent screening of thyroid, liver, kidneys and stomach can be performed, which along with agglutination tests for rheumatoid factors, thyroid and red cell antibodies and by radioimmunoassay for intrinsic factors and acetylcholine receptor antibodies can give accurate diagnosis. Solid phase ELISA is used to detect antibodies to DNA. Complete blood count, that is CBC, erythrocyte sedimentation rate ESR, C-reactive protein CRP are some of the other tests that are also done for effective diagnosis. Treatment. The main aim of treatment that is employed is to minimize symptoms, put a control on the autoimmune process and to substantiate the body's immune system and enable it to fight disease. The line of treatment that is followed is dependent on the specific disease and its symptoms. They can be of various different types. Certain immune suppressive drugs that control or reduce the immune system's response are prescribed. These include corticosteroids such as prednisone, certain non-steroid drugs such as azathioprine, cyclophosphamide, mycophenolate, sirolimus or tacrolimus are also used. They can also be supplemented with certain anti-inflammatory drugs as well. Using antibody and T-cell idiotype manipulation techniques, inducing antigen-specific unresponsiveness to T-cells by making use of small peptide segments that are administered parenterally, orally or through the nasal spray in the patient. Replacement therapy, whereby the patient is given supplements to replace a hormone or vitamin that is lacking in his body. Blood transfusions or plasma exchange can also be effective in cases where the autoimmune disorders affect the body. Thymectomy or plasmapheresis, that is removal of antigen-antibody complexes, can also provide, although a very short-term relief. Physiotherapy or assistance may be provided to patients where the disease has produced some physical damage. And finally, certain cell-blocking agents. Dear students, so we can summarize our lecture by saying that immune system is the most important system of our body. It needs to provide effective defense against foreign antigens, but a tolerance towards self-antigens. The breakdown of this tolerance leads to autoimmune disorders. Hence, in autoimmune diseases, the system starts mounting immune response to the self-antigens. This is highly undesirable. Autoimmunity hence is thought to bypass the normal regulatory mechanisms of the body. It just bypasses all the checkpoints of our body. The autoimmune diseases could be against the blood cells or could be against an organ specific or it could be non-organ specific or it could be transitory in nature as we have understood in our lecture. The treatment involves reducing the symptoms or making the immune system stronger to overcome the damage that has been inflicted due to these autoimmune disorders. So, thank you very much, students.